Welcome to the Beauty Equation podcast, where beauty meets biology, psychology, and art history. This podcast is hosted by myself, Dr. Christelle Oliver-Dussault, Dr. Harpreet Lotay, and a beauty industry expert, Amanda Manholt. This is your space to reclaim agency over aging and beauty on your terms. We're cutting through the noise with evidence-based insights and real talk about aging, self-perception, and modern treatments. No quick fixes, no fluff. Just honest conversations to empower you to define beauty for yourself. Welcome to the Beauty Equation. I am Dr. Christelle Oliver-Dussault.
I'm Amanda Manholt.
And I'm Dr. Harpreet Lotay.
Today we're going to keep our conversation on bioregeneration, focusing on an ingredient called calcium hydroxyapatite, or CAHA. It's a mouthful, and it is one of those ingredients that has lots of different ways to help you regenerate your skin, regenerate what's going on underneath your skin, and it comes in different forms. You may have heard of Radiesse, which we've had for years, and we'll talk a little bit about that. But first, I want Harpreet to tell us about HArmonyCa, because she was one of few physicians invited to the launch of this new product in Montreal. And I can't wait to hear about what that weekend was like. And I know that you've used it a lot in clinics since you've come back.
She's used a ton. So let's just say I think I'm on my third order for her.
Wow.
Covered going, where did it go?
Yeah. So I want to hear more about this.
Yeah, it's truly an innovative product that was just launched in Canada, but it's not new to the world. It's been around for 15 years in over 50 countries, primarily South America, and it does have calcium hydroxyapatite in it, but it also has a unique way of bonding hyaluronic acid to that molecule as well. So it's dual action. It not only lifts and volumizes, but it also gives ongoing skin rejuvenation, which is super exciting. And what I love is that it is wonderful for treating the lateral part of the face. So if you have ever looked in the mirror and done a little lift by your ear and thought, that looks much better, this product could be for you. It is usually injected in that lateral aspect where we lose volume. And when you leave the office, you see an immediate effect. But what I love is that you do get that bioregenerative effect as well over that 3 to 6 to 9 month period. So you're actually improving your skin, which we know ages just like the rest of us. It's not just volume loss. It is also changes in our skin and laxity and all that. So it's really exciting.
How do you find it's performing in terms of those little accordion smile lines that people don't like? When we start to lose that volume in there.
Well, this is the interesting thing, that you'll see the effect of that over a 3 to 6 month period, but you generally don't inject it into that area where we see those accordion lines. So it's lovely to have two options. It's lovely to have Radiesse, which is what we have used in Canada for a long time as a CAHA bioregenerative treatment. This area I would still address with hyperdilute Radiesse, because we don't want to volumize the front of the face. We know that as we age, the front of the face gets heavier and looks like it's fuller because the lateral part of the face loses volume. So HArmonyCa is reserved at this point for behind the line of ligaments, what we call the line of ligaments. So it's sort of this line that goes from the edge of your eyebrow on the side down your cheekbone, down to kind of where your marionette line would end, in that region generally. And so you want to use it behind that line and kind of low down, because we don't want to induce some fullness.
So it sounds like a treatment to me that really gives immediate results, but also has the added benefit of giving you an improvement in skin quality in a few months' time. And patients walk out seeing a result right away, which when we talked about Sculptra a few weeks ago, that patients really have to trust that, yes, this will work, because they don't necessarily see the result right away. So probably would be better for someone who is looking to have that immediate result. And volumization almost sounds like a mini facelift done from under the skin and addressing that loss. from the different layers.
Yeah, you're exactly right. So it is perfect for people who want to see an immediate change and, are ready for something more. So definitely, and it can be used in combination where you're using hyaluronic acid fillers in other areas of the face as well. So it gives us an additional tool and a lot of versatility for sure.
Yeah, that's great because we already know quite a lot about it's combining two great ingredients we're familiar with and know how behave hyaluronic acid
Yes.
gels, which can come in different concentrations, and Radiesse, which we didn't really talk about yet, but we've used it a long time. And based on how we dilute it, we can use it, as you mentioned, on the accordion lines. We can use it on the back of the hands
Yes.
or in the chest to really help those that creppier skin that gets really,
Yes.
really fine and you're really looking to thicken it. But the harmonica sounds to me like it is a little bit different and it's really on a deeper plane and lifting effects, which is quite exciting as a tool.
Yeah, absolutely. Lifting effect is right. And I still love Radiesse just for those reasons, for that improvement in skin quality and the ability to use it in so many different areas, including on the body and the hands, as you mentioned. So it is wonderful for skin rejuvenation. Absolutely.
Mhm. There was a recent study as well too, which I haven't had a chance to read, but I'll mention it anyways, that radius seems to have an impact on hyperpigmentation. So skin discoloration and darker spots, it seems to improve that as well. So I might bring that up in a few weeks' time once I have a chance to read it fully, which is always an interesting application because oftentimes we'll see that as the skin ages, those years of exposure to UV light and
Yes.
sunshine do appear on your skin, because let's face it, most of us weren't paying attention to putting sunscreen on when we were younger. I know I didn't. So anything that helps with that is always an added little bonus.
Yeah, absolutely. That's part of how the skin ages, that dyspigmentation, and then also that loss of glow, which I love to see when we're using these injectables, even Sculptra, anything where we're improving collagen, you get this glowy look because collagen is white. So it gives this reflectiveness to the skin, which we lose.
One of the things that you both do often is mix
Mhm.
Radiesse and, for example, one of the Bellateros, which essentially I'm thinking, well, gee, well, that's calcium hydroxyapatite and HA, and you're mixing your own little
Mhm.
version of it for depending on where you're using it different ways. And then I'm thinking, well, what's the difference then? So if harmonica's like already done for you,
Mhm. Well, I think that's one thing that it's already done for you, but it is a different process. So if you imagine, let's see, blending a thick custard with a slightly thinner jelly and swishing it back and forth, trying to mix it, it's hard to get a homogeneous
Mhm.
blend.
Mhm.
So that's one aspect to consider. But the process of making harmonica is different than just blending the two products together. You have molecules of the CAHA and you have molecules of the hyaluronic acid, and they get stuck together with binding proteins called BDE. And then
Mhm.
those clumps of bonded materials then get bonded to other clumps. So it's a completely different process. So it's not something you can replicate by blending the radius, although that is something that we have done for a long time as well, where we blend it and we give people instant volumization. And that we can still certainly do that if we're trying to give volume in areas where we don't typically use harmonica and we want to see some skin improvement.
Mhm.
and then maybe speak to longevity of these products. What can people expect? How often are they coming to see us?
Yeah, I would say with the harmonica, you should get an effect that's lasting a good 12 to 18 months, and then you may want to do a redo. The jury's really out on that. We may see a longer lasting effect on that. In my practice, when people do Radiesse, I would say it's 12 months or so.
Yeah, great.
Yeah, similar. Sometimes longer, I find with the radius combined with the HA. I really like that combination as well. So, particularly patients who have had that hyaluronic acid on its own for lifting, and for whatever reason, they're quite fast metabolizers. I've noticed that when the two are combined, they seem to get a bit more longevity out of the procedure than used alone.
Maybe that's because the skin improves,
To
right?
me, that's what makes the most sense is that that bioregenerative component will have an impact on the duration, where as opposed to just the hyaluronic acid on its own.
Yeah, it's great to have both tools, that's for sure.
And I like to hear that it's been around for a long time.
Yes,
So
yes.
I think that always puts my mind at ease.
Mhm.
I'm not really excited when they're like new.
No.
Okay. Well, how many people have used it and how many times did it not go well? And,
Yeah.
so the fact that it's been used in other countries for years is always a good thing.
Have you noticed any adverse effects with harmonica, or was that something that was discussed that would be different from what we already know in terms of like traditional fillers or bioregenerative ingredients that we have?
No, they're right in line with what we already know. So there's no new adverse effects due to the novel integration of the two materials. So everything stands. You want to be careful with how you're injecting it, obviously, and caution around being mindful of where vessels are and all that is all the same. And we
Right.
wouldn't want to use it in people who have autoimmune issues or have, unchecked inflammation. That still
Mhm.
is a caution.
Great. Well, I'm excited because
Yeah.
again, I have to keep ordering it. So
I just
Yeah.
like that we have more and more options that we
Yes,
can tailor our treatment plans for the person in front of us.
absolutely.
And I think sometimes it can be overwhelming when patients come in for a first consult because it does take some time to tease out what they see, what their goals are. But for me, it's nice knowing that there's an additional tool in our pocket now.
Mhm.
Because, yeah, I have really enjoyed mixing Radiesse with hyaluronic acid or even hyperdiluting it with saline for seeing that improvement in skin, the volumization that you can do. But I'm quite excited to try this and see how it compares.
Awesome. Well, if you liked this episode, please remember to like and subscribe and tune in next time when we get together for another little chat.
Yeah, I think we might talk about pigmentation, sunspots.
Things you can
Sounds
do in the
good.
summer.
Yeah,
Yeah.
as we're sitting here looking out at blue skies,
Yes.
might be a good one to talk about. Until
Great.
next time.
We'll see you next time. Before we wrap up, just a quick reminder. While we're medical professionals, everything shared on the Beauty Equation is for informational purposes only and isn't intended as medical advice. This podcast doesn't establish a doctor-patient relationship, and any medical or aesthetic decision should always be made with a qualified healthcare provider. Our views are our own and don't necessarily reflect those of our employers or affiliated organizations. And remember, the field of aesthetics is always evolving, so information may change over time. See you next time on The Beauty Equation.
Thank you for tuning in today. If you enjoyed today's episode, don't forget to like, comment, and share it with someone who might need to hear it too. We'd love to hear your thoughts or questions. You can send us an email at info@thebeautyequation.com, and you might hear your question answered in future episodes. You can also find us on Instagram at Dr. Christelle MD, at HLotay MD, and at Crow's Feet and Confidence. Until next time, keep questioning the equation.